Welcome to the Rotary Impact Podcast, the podcast that delves into the heart of transformative projects both in and outside of Rotary, spotlighting the stories of changemakers who are reshaping communities and forging a brighter, more equitable world. Celebrating those who live by the motto, service above self. This series is a tribute to the true doers, the people of action. Here's your host, Jamie WaterAid's.
Hello Rotarians, changemakers and people of action. I'm Jamie WaterAid, and this is our first episode of the Rotary Impact Podcast. In our first episode, I'm joined by Tom Muller from WaterAid Australia. Tom is the Chief Executive Officer of WaterAid Australia. He's a seasoned leader deeply committed to addressing global water, sanitation and hygiene challenges. With a career spanning over 9 years at WaterAid, Tom has significantly contributed to shaping the organisation's strategic direction, demonstrating exceptional leadership as a CEO and previously as the Director of Policy and Programs. Tom's passion for creating sustainable water, sanitation and hygiene solutions was ignited by his early experiences working in Afghanistan, where he witnessed firsthand the impacts of water scarcity and inadequate sanitation on communities. This experience has fueled his determination to catalyse change and forge partnerships that amplify WaterAid's mission to ensure universal access to clean water and sanitation. Tom, thanks for joining us. Can you share with our listeners a little bit about what WaterAid does and your role within WaterAid, and perhaps a bit about your journey leading to your role in becoming the CEO of WaterAid?
Yeah, absolutely. So WaterAid Australia is an international NGO that works on water, sanitation and hygiene. We predominantly work in Papua New Guinea, Timor-Leste and Cambodia, but we're part of the WaterAid Global Federation, where there's about 22 country programs across West Africa, Southern Africa, East Africa, South Asia, one country program in Colombia as well. And so we contribute to WaterAid's global mission, which is a vision for everyone everywhere having universal access to water, sanitation and hygiene. I've been in the organisation since 2015. I joined as the Director of Policy and Programs, which was a role that I continued in until June last year when I was appointed to the Chief Executive role. I've always worked in international development or with Australian social policy, social justice organisations. So I started life out doing Australian Volunteers International in 1999, working in Afghanistan for a body called the Agency, Coordinated Body for Afghan Relief, worked for some other international NGOs, worked for Homelessness Australia, worked for the Tasmanian Council of Social Service. So I've always been driven by a commitment to social justice and tackling poverty and exclusion wherever that might be.
Thank you. That's an impressive background and one that I'm sure serves you well in your current role. Let's talk about water for a minute. How does the lack of access to clean water impact the daily lives in communities that WaterAid serves? And the second part of this question is, what strategies or projects do you employ to address that issue?
Yeah, I mean, look, water is life. Water is everything. So it impacts the health, the well-being, the effectiveness of agricultural programs, the ability of communities to thrive. So we really focus on creating access to water for households and in schools and healthcare facilities where there's a lack of access. We focus on helping to build, in the East Sea Pickup around Wewak in Papua New Guinea, building water systems. So you've got a gravity-fed system to actually bring the water directly to where the households are in the village. We really look at working with communities in Timor-Leste to make the water resource, protect the water resource, extend the pipeline of the resource to households. And when I say pipeline, we're talking about bamboo pipes here that are really simple, but they're very easy to maintain. We really focus on how do you have sustainable solutions that communities can maintain themselves. I was in Manafahi earlier this year in February, visiting a community that we first worked with in 2011, and that community used to spend 2 hours walking to reach their water. So mostly young children or women would spend 2 hours very early in the day going to fetch the water. In 2011 we did work to have a very simple pipe system to bring the water to the households. There was some major flooding last year, and it really destroyed all the water systems. So we went back and worked with the community and helped them build back better, build more resilient facilities. And it was interesting just sitting there and talking to the community around, do you talk to your children around what it used to be like before 2011? And absolutely, if you've got 2 hours out of your day having to go and get water, it's not clean, it's not treated. It has such an impact on your health and your well-being. It has such an impact on girls' education in particular, because they can't prioritise education when they're having to fetch water and do other chores around water as well.
Yeah, that's interesting, and that sort of segues nicely into my next question. We're talking about gender equality and access to clean water. On the surface, seem like two unrelated issues, but you've touched on something there. And maybe for our listeners, can you explain the effects of a lack of clean water, particularly on women and girls?
Yeah, and I mean, I'd like to sort of expand it in terms of the lack of sort of water and sanitation and hygiene. I mean, one of the things WaterAid Australia has done a lot of work on, particularly in Timor-Leste and Papua New Guinea, has been around menstrual health and menstrual hygiene. And we know the correlation between girls dropping out of school when there aren't safe toilet facilities that let them manage their menstruation with dignity and in a safe way. So, there's a real gender dimension around whether or not schools are catering to the needs of girls, but also the teachers. I mean, in Papua New Guinea, often what you'd see is that the girls would not come to school or they would leave school. And so actually having safe, secure toilet blocks that have facilities that help you manage menstruation is transformative in terms of education and participation and choice. So that's one example. In some of the work we've done in Cambodia, really about driving decision making. We've worked with female community leaders to have them be part of the governance structure for the water system, so that you're really getting the views and the inputs of all community members to shape the decisions that are being made. One of the things I love most about some of the work we've done in Cambodia is working with a female water operator who runs her own micro water utility, if you like, because in Cambodia there's about 400 piped water operators. They're all private, some of which are regulated, some of which are totally unregulated. And this woman runs her own mini water utility, if you like, servicing a certain geographic area. And her commitment to really extending the access of the piped water system to the poorest households really comes from her own experience of being a child, having to collect the water. So again, the burden of not having access to water is very gendered. It falls on women and girls to collect the water. And so, part of the transformative power of water, sanitation and hygiene is just the different impacts it has for women and girls in their life.
And what are some of the biggest challenges that you face in your mission to provide clean water, decent toilets and good hygiene?
It's a good question. There are always lots of barriers and challenges, but I suppose what I find is the joy of doing the work, and it's the opportunities that come from doing the work, and the joy that comes, and the satisfaction that comes from really partnering with Cambodian organisations and Timorese organisations and Papua New Guinean organisations, so that they're the ones that are driving the change. I think development, globally has seen that you have poor outcomes when solutions aren't grounded and built in context. So we really focus on context-based solutions, and we focus on what we call a system solution. So you think about where you're sitting and you've got a cup of tea, and you probably, when you made your cup of tea, you boiled your kettle, well, you poured the water out of the tap into the kettle, you boiled it. You probably didn't think about it too much, but obviously that water's been, it's been treated, it's been cleanly piped. It's managed by a water utility that's regulated, that's got the human resource capability, that probably has a strategy around climate change and the impact of climate change. It's probably connected into catchments, and there are other organisations managing the potential for flooding. So, your access to good, clean water is not just the tap, it's not just the pipe, it's this whole system. So when we work in, Papua New Guinea, we try and work with civil society organisations, but we also work with, the Department of Education. So when we're doing work in schools, you want the Department of Education to have a strategy to be maintaining the facilities. Or when we're doing work with communities, we work with the district, local government and say, okay, well, what's your plan? How are we, over time, going to increase access to all the different households that don't currently have access? And how are you going to finance that and maintain it? So the biggest challenge, I would say, that most water, sanitation, hygiene actors would face, it's that longer term challenge around what's the operation and maintenance costs. It's easy to go in and do a project, but have you thought about all the ongoing operations and maintenance costs, so that once you put in a facility, it's going to be functional and sustainable over time? Because that's what we really want. We want ongoing, sustainable access to clean water.
Yeah, great point. And you've been with WaterAid for 9 years, is that right?
Yep, that's right.
And through that time, you've seen a huge variety of projects. Could you tell us maybe about a community or project that particularly resonates with you at a personal level, and maybe why? Yeah,
I might pick a project. We're doing some work in an informal settlement in Port Moresby. It's with the Moita Koita Assembly. And the Moita Koita are the traditional owners of the land around Port Moresby. And we're working with them in one particular village, Parry. There are about 6,000 households. There's some pretty good households in terms of the nature of the house, but there's some households which are built on stilts going out over the bay, drop toilets going into the bay. The households, those 6,000 households, have to cart in water, or they have to buy in bottled water. They don't have access to clean water. They've got to bring it in by different means. Once upon a time, they were connected to water PNG, which is the utility, but for a long time they haven't been because they couldn't pay for that access. So we've been working with the community to come up with a model whereby they've got a system that manages all of the water that can be piped in from water PNG, and that the households would pay a tariff, but the tariff will be much, much, much reduced from the costs they're paying, the exorbitant costs they're paying from trucking in water. To go to this village and to see the village leaders, and so one of the village leaders is, it's a woman by the name of Atta. She's got such a vision and such a passion for her community, and such an understanding of actually the transformation that will come when there's easy access to water for those 6,000 households. So I guess that's a project that really sticks with me, because it's about those 6,000 households. Yes, it's about water, but it's actually also about the whole governance and how do you negotiate with different stakeholders in countries so that there is a new long-term solution. So we've done all the work with the community, but we've also done all the negotiations with water PNG so that they're going to support the community once the system's in place to manage the water. I love that work because again, you can see the kids running around. There's lots of kids running around. It's a vibrant community. People are happy, but actually, there's so much more that will come once the water's flowing.
Yeah, it really does change lives and change communities. In my pre-show research, if you like, I was reading a bit about your vision. You actually touched on your vision in your opening statement. I think it's compelling. It's one of the clearest visions I've ever seen of an organisation, and particularly a non-profit. Share that vision with our listeners, and how do you describe that vision to those maybe new to your organisation's work?
Yeah, I mean, the vision is universal access to water, sanitation and hygiene for everybody, everywhere. It's the fundamental right to water, sanitation and hygiene. It's so basic that often I think governments that work on development forget about it. They're focused on economic development or they're focused on other aspects. But actually you can't have health outcomes. You can't stop diarrhea. You can't stop malnutrition. You can't stop stunting. You can't let communities thrive unless you're guaranteeing the most essential. So for me, that vision is about guaranteeing the most essential things that humans need for their own health, well-being and choice. For me, water, sanitation and hygiene is actually, it's a fundamental human right, but it's also fundamentally about individual and community choice, letting people decide how they want to spend their life by actually having the access to water, sanitation and hygiene. And it shouldn't be something that people are missing out on, but in too many places it really is. And we focus on the basic access, so basic access to sanitation, not necessarily safely managed. So safely managed is where the shit is fully separated from humans, and it's fully treated and it's fully safely managed. We're really trying to break the pathway by which people defecate in open, and that then has all the flow-on effects. I mean, links to diarrhea that I've touched on, but lots of other health diseases that are really linked to defecation. So our mission is to help break the defecation impact, to help give people the powerful benefits that water and hygiene really have. And we saw that through COVID-19. I mean, a lot of the work we did in places like PNG, Timor and Cambodia, it was a huge focus on hygiene messaging and a huge focus on trying to rapidly scale up the work we were doing to support people so that they could be managing their own risks.
Yeah, incredibly profound. And a powerful vision, and when a vision is so clear and pointed, it's something that many people can get behind. So well done on that. How does WaterAid engage in advocacy? To perhaps change policies and practices related to water, sanitation, and hygiene.
Yeah, that's a really good question. It's a really important part of what we do, and we do it at multiple levels. One of the things we've been working on globally, but in Timor, PNG and Cambodia as well, has been around healthcare facilities. We've done a lot of projects modelling, what you need to do to ensure that healthcare facilities have water, sanitation, hygiene. And then we've done it with the government departments so that they're also then willing to change their policies, their procedures, their standards, so that changes their government's funding arrangements for healthcare facilities. So recently in PNG, the health department signed off on new water, sanitation, hygiene, healthcare facility standards, which was a direct relationship to our work. Back in 2017, we did a lot of work in Cambodia around healthcare facilities, and then colleagues from Cambodia were part of WaterAid's delegation to the World Health Assembly, and there was a resolution passed at the World Health Assembly around water, sanitation, hygiene and healthcare facilities. So we use our evidence from our programming to influence governments, but also to influence global processes. We're at a global level engaged in debates around COP, climate change, adaptation, and why there needs to be a focus on water, sanitation, hygiene. In an Australia context, I was up in Canberra a couple of weeks ago with other NGO leaders, engaging with parliamentarians, talking more broadly around the importance of overseas development aid and the need for Australia to have a strategic, longer term and increased commitment. So we often work in coalition with other organisations, as well as working out on our own core mission and vision around water, sanitation and hygiene. So it's really crucial to what we do. We work with a lot of corporate partners. I mean, we're very lucky in WaterAid. that we were founded by the Australian water industry. So we have about 60 water industry actors who support us. But we do, part of what we do in engaging with them is continuing the message and the advocacy around the importance of water, sanitation and hygiene, and why we continue to need to focus on it.
Yes. Is there a message that you'd like to share with our listeners who perhaps want to support or get involved with WaterAid?
Look, I just really encourage those that want to get involved to have a look at our website, have a look at the impact. This year is our 20-year anniversary, so we're celebrating 20 years of programming in the countries I've mentioned. We've reached 5.7 million people over those 20 years. We started with an initial small grant of $45,000 in 2004 doing work in the highlands of Papua New Guinea. And since then, we've worked across 14 different countries, partnering with different parts of WaterAid globally. So I'd really encourage your listeners to look at what we do, but also just to read up on water, sanitation and hygiene. And if the vision of universal access to water, sanitation and hygiene grabs you, we'd love it if you made a donation, but more importantly, we'd love it if you just keep talking to people in your community about why water, sanitation and hygiene should be something that we can actually ensure everybody everywhere has access to.
It's a crucial conversation to have. Tom, is there something that I missed, something that I should have asked, or something that you want to perhaps share before we wrap up today's interview?
I mean, look, we really focus on universal access. So a lot of the work we've done over many years as well is focused on disability inclusion, ensuring that people with disability can live with the dignity of access to water, sanitation and hygiene. So I'd highlight that as a body of work that we've done for many, many years, which gives us huge satisfaction because we're really focused on the dignity of everybody. So again, I'd encourage your listeners to look at the full spectrum of issues around water, sanitation and hygiene, and the benefits that come from all different parts of our society when there's universal access.
Tom, thank you so much for your generosity and time today. Thank you for your impact and the impact of the people in WaterAid, your organisation. I hope we cross paths again soon.
Many thanks, Jamie. I've really enjoyed it, and I hope that your listeners enjoy it, and I wish you every success in what you're doing too.
Thanks again. Cheers and bye for now.
Thank you very much.
And that wraps up another inspiring episode of the Rotary Impact Podcast. A heartfelt thank you to our supporters, the Rotary Club of Castle Hill, and Skill Samurai, Coding, Maths and STEM Academy, for their commitment to fostering positive change and empowering the next generation. If you've been inspired by today's episode, or if you have a project or know a Rotary Club that's making an impact in your community, we'd love to hear from you. Your story could be the spark that ignites a movement or the encouragement that someone needs to take that first step towards making a difference. Until next time, keep pushing boundaries, keep innovating, and keep living by the motto of service above self. Thank you for joining us on the Rotary Impact Podcast.